this video, we will discuss congenital eyelid malformations. Congenital eyelid anomalies are common but clinically important because delayed diagnosis can lead to permanent visual loss. Congenital eyelid malformations result from abnormal development of eyelids, canthi, or surrounding structures. They may occur in isolation or as part of syndromes. Early recognition is essential to prevent amblyopia and exposure keratopathy. Epicanthic folds are usually physiological, but epicanthus inversus is pathological and syndromic. These are vertical folds of skin extending from upper or lower lid towards the medial canthus. They are common in infants and certain ethnic groups. They may cause pseudoesotropia. Epicanthus inversus are folds which extends upward from lower lid towards medial canthus and is associated with blepharophimosis syndrome. Telecanthus. Telecanthus is a soft tissue abnormality and should not be confused with hypertelorism. In telecanthus, there is increased distance between medial canthi. Medial canthal tendons are elongated and interpupillary distance is normal. Telecanthus versus hypertelorism. Hypertelorism has increased bony orbital distance. Blepharophimosis, ptosis, epicanthus inversus syndrome or BPES. It is characterized by narrow palpebral fissures, severe bilateral ptosis, epicanthus inversus, and telecanthus. It has an autosomal dominant inheritance with mutation in FOXL2 gene. BPES type 2 is associated with premature ovarian failure. Epiblepharon. Epiblepharon should not be confused with entropion and usually does not require surgery. It is an extra horizontal skin fold across anterior lid margin. Lashes are directed vertically or inward. It is common in East Asian children. Manual traction of skin makes lashes assume normal position. It often resolves spontaneously with age. Congenital entropion. Upper lid entropion is usually secondary to microphthalmos and causes mechanical inward rotation. Lower lid entropion is due to maldevelopment of lower lid retractors. The management depends on severity and corneal involvement. Cryptophthalmos. It is a severe malformation often associated with life-threatening systemic abnormalities. It is a failure of eyelid formation. Eye is covered by a continuous layer of skin. The types are complete cryptophthalmos and incomplete cryptophthalmos. The associations are Fraser syndrome and syndactyly and genitourinary anomalies. Euryblepharon. It is a horizontal enlargement of palpebral fissure and is associated with lateral canthal malposition, often associated with lateral ectropion. Euryblepharon leads to exposure problems due to poor lid apposition. Microblepharon. It is usually part of more complex orbital malformations. It is abnormally small eyelids, often associated with anophthalmos or microphthalmos. Management is usually reconstructive and may require staged procedures. Ablepharon. It represents failure of eyelid formation rather than malposition. It is the absence or severe deficiency of eyelids. There is defect of the anterior lamella. The associated syndrome is ablepharon macrostomia syndrome, which is characterized by large mouth, abnormal ears, and genital anomalies. The treatment includes reconstructive skin grafting. Congenital upper lid eversion. It is a rare condition seen in neonates. It is more common in Afro-Caribbean infants and is associated with Down syndrome and ichthyosis. The clinical feature is everted upper lid with exposed conjunctiva. Despite alarming appearance, most cases resolve with conservative treatment. Lubrication and pressure patching are sufficient. Ankyloblepharon filiform adnatum. It is easily treatable but should not be missed in newborns. Here, the upper and lower lids are joined by thin bands. It is usually sporadic, may be associated with syndromes. Treatment is by simple division with scissors, often without anesthesia. Coloboma of eyelid. It is a partial or full thickness eyelid defect due to failure of lid fusion. Upper lid coloboma occurs at the junction of medial and middle third, whereas lower lid coloboma occurs at the junction of middle and lateral third. The upper lid coloboma is more visually threatening due to corneal exposure. The associations are Treacher-Collins syndrome and Goldenhar syndrome. Treacher-Collins syndrome. It is a mandibulofacial dystosis characterized by down-slanting palpebral fissures, lower lid coloboma, and ear anomalies. It has an autosomal dominant inheritance. Some exam relevant points. Epiblepharon corrects with manual traction. Telecanthus has normal interpupillary distance. Upper lid coloboma is more dangerous than lower. BPES is linked to FOXL2 mutation.